Hello guys, so now we shall be discussing regarding the external features of cerebral hemisphere. Okay, before we discuss the external features of cerebral hemisphere, first of all you have to know where are these cerebral hemispheres, right? So in the anterior view as well as in the lateral view, how does they look? Okay, so first of all what we shall do is that in the anterior view, how does these cerebral hemispheres look? For example, as you can see this picture over here, so these are your cerebral hemispheres like this, okay, and after that you see this some structure that is coming out of that, this is called as your midbrain, and here you have got your pons, right? This is your medulla oblongata, and hanging down it is your spinal cord. Regarding the basics, I have already discussed in my previous lectures, okay. So how cerebral hemispheres are formed? They are formed from prosencephalon. Prosencephalon is later on divided into two, right? Telencephalon and diencephalon. So these things regarding the brain vesicles I have already discussed separately. So here, if you carefully look, so these structures which I am highlighting right now, okay, so these structures which I will be highlighting right now, these are your cerebral hemispheres. And by the way, let us start from the complete basics, okay. How many cerebral hemispheres do we have? We have got two important cerebral hemispheres, okay, right as well as the left cerebral hemisphere. Now, the same picture, if you are looking from the lateral view, how does a lateral view picture looks? So this is how a lateral view picture looks. This is your cerebral hemisphere, right? And here you have got your midbrain, and then you have got your pons, then you have got your medulla oblongata, you have got your pons, you have got your medulla oblongata, and here this is your spinal cord in this way, right? So this is a picture from the lateral view. And where are the cerebral hemispheres again? You see, these are your cerebral hemispheres, okay? These are your cerebral hemispheres. So if you see here, this weave is called as the anterior weave, right? And this weave over here is called as the lateral weave, okay? So now what we shall be doing is that we shall discuss what are the external, right, external features of cerebral hemispheres. So coming to the external features of cerebral hemispheres, external features of cerebral hemisphere. So we shall be mainly focusing on the external features of the cerebral hemisphere. Now coming to these external features of cerebral hemispheres, we have to mainly concentrate on four important. What are those four important things? We have to see what are the poles of the cerebral hemisphere. There are three different poles. We have to see what are those poles. We have to see what are the borders. We should also see what are the surfaces, right? And finally, how many lobes are present within the each cerebral hemisphere also we have to see, okay. So what are the structures we have to see? First is we have to look at the poles, next we have to look at the borders, surfaces, and finally the lobes of the cerebral hemisphere. So first we shall discuss like this. So we will be discussing about the poles of the cerebral hemisphere, we shall be discussing about the surfaces, we shall be discussing about the borders, right, and finally we shall be discussing about the lobes. So these are the structures which we shall be focusing on. So first, as usually, we shall discuss about the poles of the cerebral hemisphere. So before that I have to draw only the cerebral hemisphere from the lateral view, then it would be easy for you, okay. So right, so let us say this is just a rough picture, okay, don't take it seriously, this is just a rough picture of your cerebral hemisphere. Now in this, okay, if I can modify it a little bit, right, so this is your cerebral hemisphere like this, right. Now within the cerebral hemisphere, if you see here, this is the front facing, this is the front facing, and this is the posterior on the back, okay. So if you want another easy picture over here, so this is how I can do. Right. So I hope you understood now, right? So let us put the brain into its own place. So I hope this is where your brain lodges, right? So in this picture, now you understood one very important thing, that this is the front facing and this is the back facing or the posterior facing, right? On the back side, in the front side, the lobes which you have is called as a frontal lobe. On the back, the lobe which you have is called as a occipital lobe. So first of all, we shall discuss about the poles. There are three poles. What are those three poles? See, this pole which you can see right now here, this pole over here is called as a frontal pole. This pole is called as a frontal pole. Next, just beneath your frontal pole, this pole which you can see here, this is called as the temporal pole. What is this pole? This pole over here is called as a temporal pole. In the same way, on the back side, if you see, this pole which you can see over here, this pole is called as the occipital pole. Occipital pole. So how many poles do we have? We have got frontal pole, we have got temporal pole, we have got occipital pole. So if I have to write it down here, so how many poles do I have? I have got 3 poles. So what are these 3 poles? First I have got is the frontal pole. Next I have got is the temporal pole. And next I have got is the occipital pole. So these are the 3 important poles which you need to know. Okay. Now after the discussion of poles is done, the second important thing we have to discuss is regarding the surfaces. Okay. So let us see now how many surfaces do we have. To look at these surfaces, we have to draw the brain from the lower part. For example, what do you mean by the lower part? In the sense, see, this is the brain which you are able to see. Right now, this brain, if you are looking it from the side, or you are looking it from the front, or you are looking it from the back, or from the top, obviously this is the brain which you are looking it from the side. Okay, so this is the brain, right? So this is how it is there. Okay, so you call this as a frontal pole. Just beneath it here you have got the temporal pole, and on the back here you call it as an occipital pole, right? So this is the picture we are looking from the side. Now what I am going to do is that, now you know that this is the top surface of your cerebral hemisphere. This is the front, this is the back, and these two are the sides of the cerebral hemisphere, right? Now what I am going to do is that I am going to remove these cerebral hemispheres and show it to you in this way. It means I am going to show you this lower surface. If I have to show this lower surface to you, I have to move the cerebral hemispheres like this, right? So this surface is also called as a lower surface, or I can call this surface as an inferior surface. Can I also call it as a basal surface, right? So there are 3 important names: lower surface of the brain, or inferior surface, or the base of the brain. Okay. So now in that view I can study about the surfaces. So let us see what are the different kinds of surfaces do you have. So for that, the picture which I would draw is in this way. This is your midbrain over here, and here comes your pons, medulla oblongata, and so on. It will continue down, right? Hope this picture is clear. So this is the inferior surface. Now in this inferior surface, let us see what are the different surfaces do you have. Now what are the different surfaces do you have, guys? So all of you just pay attention to whatever I am teaching you here. See, this surface all the way from here till here, right? Now in the same way, this surface also, the same surfaces on both the sides. Now this surface, can I call it, because this surface is on the top, right? So can I call it as superior, and this surface is towards the midline or away from the midline? It is going away from the midline. Yes or no? So can I call it as superior lateral surface, right? Yes. So this surface is called as superior lateral surface. Now after the superior lateral surface, next surface which you have is here. So if you see a surface all over here which is exactly near to the midline, here this is midline. So this surface is located towards the midline. Anything pointing towards the midline, I have already told you, is called as a medial surface. So can I call this one as a medial surface, right? So this surface over here, you call it as a medial surface. medial surface. Okay. Now, by the way, tell me, what is this deep groove inside? This deep groove inside is also nothing but called as fissure, and this fissure is longitudinal, right? So that is the reason why I can also call it as longitudinal fissure. Longitudinal fissure. So longitudinal fissure is which surface? Medial surface or superior lateral surface? It is medial surface. Okay. Next, third important surface which you have here is that this surface which you can see this entire surface which I will be highlighting now. You see this entire surface. Okay, you see this entire surface which I have highlighted right now. This entire surface, can I call it as an inferior surface or can I call it as a basal surface, right? Yes, so this surface over here is called as the inferior or the basal surface. Inferior or the basal surface. So these are the surfaces of the brain. How many surfaces do we have? We have got three important surfaces. The first surface is called as a medial surface, right? So let me write it down here. So regarding the surfaces of the brain, external features of the brain, in that the surfaces part, we have got three important surfaces. So what are these three important surfaces? First important surface which we have got is superomedial or superolateral. Superolateral surface. Next surface we have got is medial surface, and next surface we have got is inferior surface, inferior or basal surface, inferior or basal surface. Okay, so these are the three important surfaces which we have got over here: superior surface, superolateral surface, medial surface, inferior or basal surface. Okay. Now, after the surfaces discussion is done, the next important thing we shall be discussing is the borders, right? So actually we have got a pretty many borders over here. So what are the different kinds of borders? So even if you wanted to know about the borders also, the same picture you will use. This is the same picture, again I will draw it. So this is the same picture you will use to name the borders. Okay. So let us look at that picture down over here. Right. So this is the inferior part. Now in this inferior part, all of you should know one very important thing, that here exactly you have got a structure called as optic chiasm. Right. So all of you know that this is called as optic chiasma. Yes or no? And just beneath the optic chiasma you have got mammillary body. So I will explain that in a minute. And above this also you have got something called as olfactory tube and olfactory tract and olfactory bulb. These things we will discuss later. But now what you need to know is that this is your inferior surface. Now in this inferior surface, let us now discuss about the borders. Now all the way from here till here we have, I think already we have discussed that this surface over here is called as superior lateral surface. That is a surface. Now I am discussing about the border. This border is called as superior ciliary border. Why it is called superior ciliary border? I will tell you in a minute. So this is called as superior ciliary border. This is called as superior ciliary border, right? Next, after that, you have got another border all the way down here. Now compare and tell me which is superior, which is inferior. Already we have named what is called as superior. Then this will be called as inferior. So inferior, and it should be called ciliary, right? But this is not called as ciliary. This is simply called as inferior lateral border. Inferior lateral border. Okay. Next important thing is that superior ciliary border is done. When there is superior ciliary border, there should also be superior medial border. Yes or no? Superior ciliary border is equivalent to another term called as superior lateral border, right? So when there is superior lateral border, there should be superior medial border also, right? So this is the superior medial border. See, this border which you can see here, this one is superior medial border. Okay, so this border is called as superior medial border, right? Next important, Next important thing is that if you can see very clearly over here, here also you have got a border like this. You see this border, right? So there is one border over here. Now what is this border? This border is lying medially, I mean towards the midline or away from the midline? It is lying medially towards the midline. And moreover, where are your eyeballs? Obviously this is the place where your eyeballs are present. Yes or no? This is the place where your eyeballs are present like this. So this border is medially towards your eyeballs. So what can I call it as? Can I call this border as medial orbital border? Because it is on the medial side and placed near the orbits. So this border is called as medial orbital border. This is called as medial orbital border. Medial orbital border. Now after that, if you look here carefully, this is how the cerebral hemispheres are actually. Okay. Now here also, all the way from here till here like this, you can see another border, and this border is towards the down, right, towards the occipital side. So can I call this border as medial? Why medial? Because it is on the medial side only. So medial occipital border. Medial occipital border. So these are the borders which you can see here, guys. So let us just look at all these borders. First border is called as superior ciliary border. Second border is called as inferolateral border. Third border is called as superomedial border. Next, medial orbital border, and finally we have got a medial occipital border. Now why you call this as a superior ciliary border? Why do you call this a superior ciliary border is that in this picture, if you see, where is this superior ciliary border, guys? All of you just look here. See, this is the one which I have called it as superior ciliary border. It means this is which lobe? Frontal lobe or occipital lobe? This is your frontal lobe. It means exactly here. You see, this border I have called it as what? I have called this border as superior ciliary border. Why are you calling it as superior ciliary? Because here you have got your eye. Here you have got your eye. Just above the eye you have got this border. Eye is the ciliary part, right? The ciliary organ. So exactly above the eyeball you have got this border. So you call it as superior ciliary border. Okay? Superior ciliary border. So let us write down all these borders over here. So the first border which we discussed over here is superior ciliary border. Superior ciliary border. And after that we have discussed about superior medial border. Superior medial border. Next we have discussed about inferolateral border. Inferolateral border. Next we have discussed about medial occipital border. Medial occipital border. Superior ciliary border, superomedial border, inferolateral border, medial occipital border, right? And we have got medial orbital border also. Medial orbital border. So these are the different borders which you have got over here, right? So these are the different borders which you have got. So overall, guys, what are the important things we have discussed here? Right. So overall, guys, what are the important things we have discussed here? We have discussed about the borders, right? So what are the different kinds of borders we have discussed? First of all, our discussion started with the poles. So how many poles do we have? We have got 3 poles, I told you. One pole is called as frontal pole. Next we discussed about the temporal pole, and thirdly we discussed about our occipital pole like this. Clear? Now after that we have discussed about the surfaces. Now what are the surfaces which we have discussed? We discussed about the medial surface, superior lateral surface, and inferior or the basal surface. After that we discussed about the borders. So how many borders did we discuss here? 5 borders. One is called as a medial occipital border. We have discussed about the superior medial border. We have discussed about the superior ciliary border, and finally inferolateral and medial occipital border. Okay, so these are the borders which we have discussed. Now what we shall discuss is that we have to discuss what are the lobes. The last part which we have to discuss right now is the lobes. So let us see what are the different kinds of lobes do we have. So for the lobes also, I have to draw the lateral picture. Right. Let us say this is the lateral picture. Now, in this lateral picture, one very important thing I want you to know. One very important thing I want you to know is that in the center here you have got a sulcus, right? So any line in the center you have got a sulcus. This sulcus is called as a central sulcus. What is the name of this sulcus? This sulcus you call it as the central sulcus. Central sulcus. Okay. Next important thing is that you have got another sulcus exactly here like this, right? So this sulcus which I am drawing here, this is called as parieto-occipital sulcus. Okay. So this sulcus over here is called as parieto-occipital sulcus. Why it is called as parieto-occipital sulcus, I will tell you in a minute. Okay, so just also remember this thing, the other name for this parieto-occipital sulcus is calcarine sulcus. Parieto-occipital sulcus or calcarine sulcus. Now what I am telling you to do is that here, for example, let us say what we'll do is that we will draw an imaginary arbitrary line, okay, an imaginary line touching the central sulcus till down here, and you know this sulcus which I have drawn here, this is called as a lateral sulcus. You see this sulcus over here is called as a lateral sulcus. So what I am doing now, I am drawing an imaginary line that is touching the lateral sulcus along with the central sulcus like this. Okay, so this is an imaginary line which I will be drawing right now. Just look here now. You see this is the imaginary line which I am drawing like this. Okay, now with the help of this line, I am dividing something. I will tell you what am I dividing. Second important thing what I am doing is that from this parieto-occipital sulcus, from here also I am drawing one imaginary line that is coming and touching this part. Okay, now what is this part, guys? What is this part? All of you see here, just look at this notch like thing. You see there is a notch like thing here. You know what is the name of this notch? And first of all, tell me, where is this notch present? All of you know that this lobe is called as occipital lobe because it is on the back side, right? You call it as occipital. So don't you think that this notch is present in front of the occipital lobe? Yes or no? This notch is present in front of the occipital lobe. So I call this notch as pre-occipital notch. I have to call it as pre-occipital notch. So this notch over here is called as pre-occipital notch. Why? Because it is present in front of the occipital lobe. Now another important thing over here is that this calcarine sulcus or parieto-occipital sulcus, from there an imaginary line I am drawing all the way, this imaginary line is touching to the pre-occipital notch, right? Now what I will do is that I will draw another imaginary line from the calcarine sulcus all the way which touches your lateral sulcus in this way. Okay, now you can see there are 4 different lobes that are formed, right? So let me highlight this. See, this is one lobe which you can see. Yes or no? This is one lobe which you can very clearly see here, right? And you can also see another lobe here. You see this is another lobe which you can see. This is the second lobe which you can see, and can you also see the third and the fourth lobe? You see here you have got the third lobe, and finally only one lobe is left over here. What is this? This is the lobe over here. You see, we have got 4 important lobes over here. So what are these 4 important lobes? The first lobe here, which is on the front side, is called as the frontal lobe. So this one over here is called as a frontal lobe. And second lobe, which you already know, that this is called as a occipital lobe. This is called as your occipital lobe. Next important lobe, this one is called as a parietal lobe. This is called as your parietal lobe, and finally this lobe is called as a temporal lobe. temporal lobe. So I hope you understood now what are the different kinds of lobes do we have. We have got 4 important lobes over here. So what are these 4 important lobes? We have got something called as frontal lobe. We have got something called as temporal lobe, frontal lobe, temporal lobe. We have got parietal lobe, and we have also called as occipital lobe. Occipital lobe. So these are the 4 important lobes which we have here over here. Frontal lobe, temporal lobe, parietal lobe, as well as occipital lobe. So these are the 4 important lobes over here. So overall, we have discussed all the important things, guys. First, we started our discussion with the poles. We discussed the poles. Next, we started our discussion with the continued with the surfaces. Again, we discussed about the borders, and we have discussed about the lobes. Okay, so these are all the important things which you need to know regarding the external features of cerebral hemispheres. So in the later on lectures, what we'll do is that we shall in detail discuss what are the different kinds of sulci you have, what are the different kinds of gyri you have, what are its names and all. We shall discuss those things. Okay, so thank you so much for watching my video. Goodbye.